So today we will discuss about complement mechanisms along with hypersensitivity reactions. Hypersensitivity reactions. Okay, so first of all, any complements are the proteins which is produced by the mainly by the liver. Liver produces complement, and complement comes to the circulation. Complement comes to the circulation. This is the blood vessel. This is the blood vessel. This is the endothelium which I am drawing. This is the blood vessel. The liver produces the complement, and complement comes to the complement proteins or comes to the circulation. So normally these complements are all inactive. Normally they are inactive complement. Okay, so there are 20 different types of complement. Many complements they are still there, researchers are finding, and most important that we call the series as complement. We give the number complement 1 to complement 9. Complement 1 to complement. These are the major proteins, and it is very important. So normally complement 1 to 9 is produced by the liver, but complement 1 mainly produced by the GAT, the gut epithelial cells. Okay, the GAT mucosal cells produce the C1. So apart from that, another group of cells which can produce complement are macrophages. They are macrophages. Phages can produce complement. So whatever it may be, all the complements are produced are inactive, and basically they are enzymes. Basically they are like enzymatic functions, and they are normally inactive. So now the question is, when they will become active? What is the function of the complement? So the function of the complement is, this complement facilitates or augments means increasing, facilitates or augments the immune reaction. Okay, so any immune reaction is going to happen, this complement is needed, because without complement immune reaction will be weak. Immune reactions will be weak. So that's why complement deficiency will lead to serious infections, will leads to see, even though if they will have good neutrophil, they will have good antibody, they will have good number of T lymphocytes, but if there is no complement, that will lead to serious infections. Okay, now this complement, okay, normally, for example, we'll take one bacteria. Okay, so this is the bacteria. This bacteria has lot of antigen, right? They have lot of antigen, so we'll draw one antigen. Okay, so they have lot of antigen, so just I'm drawing one antigen. They have lot of antigen in their surface, right? Let us draw 2 3 antigen. Okay, now this antigen, you all know. Okay, what happens, this bacteria will be taken by the macrophage, and what they do, they process, and they show the antigen, they present the antigen to the T lymphocyte. So the T lymphocyte, and the T lymphocyte releases chemical substances, and that will activate the B lymphocyte, and the B lymphocyte sensitized, and they produce the antibody. They produce the antibodies. Okay, the antibodies normally we put like this. It is has some meaning. The antibodies has two heavy chain, two light chain, two light chain, and this is called FC portion, and this is called F. Come on, you guys. FAB portion. Okay, so now please concentrate on this FC portion. Okay, now this antibody comes and attached to the antigen. Comes and attached to the antigen. Once it attached to the antigen, you can see what happens if they attach to the antigen. The antigen antibody complex is formed, right? Once antigen antibody complex is formed, what will happen to the tail of the antibody? There will be configurational change happens. Okay, there will be change happens here, so that there will be some change happening here. This opens the space for complement to attach. This opens the space for complements to attach. Okay, now in this case the complement 1 comes and attaches. Okay, the complement 1 comes and attaches. Okay, this is what complement 1. Complement 1 has 3 component Q, R, S. Okay, they hold the antibody very tightly with the Q component. Understand? So complement 1 now got attached. This complement 1 immediately activates complement 4. Okay, actually it's why it is not in order is the scientist found this complement in their numbers. Okay, so then they after that they found that complement 4 is getting activated by the complement 1. Okay, so now complement 1 Q activates the complement 4. These complements all has C4 B and C4A. They are two components, C4B and C4A. Once it attaches, then they get separated. They get separated, and the complement 4A separates out from the complement 4B. You understand? Yeah. So complement 4A separates from the complement 4B. Just we make it smaller. Complement 4B before B is formed. Okay, now then these two together will activate C2 complement 2B, and then the 2A is separated. Complement 2A is separated. Understand? So now this all this together will activate complement 3. Okay, complement 3. I am drawing complement 3B in different color because it is very important. Okay, so complement 3A is separated. You all understand? Yes. Okay, now this is called C3 convertase. This is called C3 convertase. This is called C3 convertase. Okay, all of together. So this C3B is formed now. This C3B, all this is called C5 convertase. So they will convert C5B and C5A. Okay, now the rest of the complement C6, C7, C8, C9 gets activated. Now let us draw the bacteria a little bit big. Now they get activated. Let's go from the beginning. So once the antigen antibody complex are formed, right? This is the complex, right? I'll use a look. This is the complex. It is formed. Okay, this is the complex formed, right? This complex is formed. Once this complex is formed, then there is configurational change happens in the FC portion. Then the complement 1 comes and attaches. Complement 1 comes and attaches. Then it activates the complement 4. C4b is attached. C4a gets separated. Then C2b be attached and C2a separated. And this C4b, C2b is called C3 convertase. And then the C3 convertase C3b is formed because of the C3 convertase, and C3a goes out. Then C5b is formed because C3b is called C5 convertase. You understand this? The C5b is formed. C5b is formed. Now this all together will activate the C6, C7, C8, C9. Once it gets activated, they fall like this on the bacteria. They fall like some hole, like a drilling machine. Understand? They just fall like they will not do any enzymatic degradation. Just they fall mechanically on the bacterial wall, and just they put a hole. So all the activation happens. See, thousands of antigen, thousands of antibody complex forms, thousands of C1 activated, thousands of C4 activated, thousands of C3 gets activated, then C5 gets activated, then 6, 7, 8, 9 activated, then they fall. So like that you see lot of holes. So what happens if you put lot of hole? They will burst because water molecules enters and they will burst. So this is called membrane attack complex. In POD I touched a little bit. Okay, in the inflammation chapter regarding the chemical mediators I told only this word. It forms a membrane attack complex. I understand. So this is about antigen antibody activating the complement. It is classically antigen antibody is formed, complement is activated. It is called classical pathway. Understand? So now I'm going to talk about this function. Okay, why it is why one of the reason is they are going to kill directly the microbes. One of the reason. Okay, they do many function. Okay, now this is the bacteria, right? Now the antigen is there in the bacteria. Okay, now this is the bacterial wall. Okay, and we have antigen here. Okay, now antibody is formed, then immediately complement gets activated. C1, then C4, then C2, C3, B. Okay, all B, right? Okay, now just see the C3B is there, right? Now C3A, C2A, C C4A goes out and C3A goes out. Understand? Now this is happening in the bacteria, right? Now if you see the macrophage, okay, this is macrophage. They have special receptor called F3B receptor. So the macrophage, now they see that there is a C3B, they come and engulf the this is the C3b receptor. This is what C3b receptor. They hold, they surround it, understand, and they phagocytose it. They are just engulf it, understand.
Yes.
So they clear it. Okay, C3b is coated now in the bacteria. Okay, so
C3B is the fungicide.
C3b is formed in the bacterial wall, right? Now C3b is coated because we have lot of antigen, right? So there is lot of C3b is studded now, understand. See, this is the bacteria. Now it is full of studded with C3b. Okay, you all know why the C3, how the C3b forming, right? Okay, now C3b is studded. Okay, now it is easy for the macrophage. It is easy for the macrophage. They have lot of C3b receptor. They take it and phagocytose it. So some complement, some part of the complement coats the bacteria and help in the phagocytosis. So any component helps in the phagocytosis, it is called opsonin. It is called opsonin. In microbiology they are taken. It is called opsonin. The process is called opsonization. The process is called opsonization. Understand? Okay, now this is one event. Another event is, see, now there is antibody, there is some circulating antigen, there is some circulating antigen. So this is the blood, this is the blood vessel, and this is the antibody. There is some circulating antigen. So antibody also there in the blood, it catches it, it catches it. Now immediately antigen antibody complex is formed, right? Then there will be change happens here. So then the complement in the circulation, it is getting activated. In the circulation it is getting activated. That is C1q, then C4b, then C2b, then C3b. Okay, now this is one. Then the macrophage, if it settles there anywhere, the macrophage will remove it, understand. The macrophage will remove it. Or now the antigen antibody complex is formed, right? Antigen antibody complex is formed. It will create some change here. Now there is a macrophage. Macrophage also contains Fc receptor. It contains Fc receptor. So this antibody can join here and they can remove it. They can remove it. So the macrophage can remove through opsonization or through Fc receptor. But actually, if there is this complement is weak, somebody is having C3 deficiency or liver disease, C3 is not produced properly, so this is not happening, understand. Then this is not happening, automatically opsonization cannot happen, then automatically the patient cannot produce enough phagocytosis, understand. So especially in complement problem, okay, or especially the terminal part of the complement is problem, what happens, they cannot lysis the bacteria, you understand. If this complement is in trouble, they cannot form the membrane attack complex, they cannot lyse the bacteria, they cannot lyse the bacteria. So that leads to severe infection. Most commonly these patients will get Neisseria gonococci or Neisseria meningococci infection. Nobody knows why they get Neisseria gonococci. Neisseria gonococci is a sexually transmitted disease, but Neisseria meningococci, it infects the meninges. Okay, so it produces severe meningitis. So it is very common in those patients. Okay, so that's why any liver disease patient, they cannot able to produce enough complement, they go for such kind of infections. Okay, and one more thing I want to tell you guys, this membrane attack complex is very good in gram positive. It is very good for gram positive. Okay, because gram positive, this is the cell membrane, this is the cell membrane of gram positive, this is cell membrane of gram negative, and they have peptidoglycan layer, they have peptidoglycan layer. Okay, very thick peptidoglycan layer. Understand? Whereas gram negative, they have small amount of peptidoglycan layer and they have another lipid layer. Okay, another lipid layer. So automatically, as if they are having two membrane, right? They are having two membrane, but here there is only one membrane. So it is easy for the terminal components to put hole. Understand? So that's why they are very effective in gram positive. If they are not, their gram positive will be difficult to be removed. Gram positive will be difficult to be removed. You understand? So this is about the classical pathway. This is about the classical pathway. So let us discuss about the other pathways. So other pathway is, now we have a bacteria or virus or any infectious agent, it come into the circulation. This is the circulation. Understand? So now we have a bacteria and the surface is exposed. When the bacterial surface is exposed, that can directly activate the C3b. C3 can be directly activated, C3a goes out. Then there is another complement that is called factor B. Factor B that gets activated and that forms factor BB, and factor BA goes out. A means away, it is going out. Okay, so factor BA goes out. Understand? Then again factor complement C3b is activated. C3b is activated, and this is C3 convertase. C3b and factor BB is C3 convertase, and this kullu is called C5 convertase. They will activate the C5b, C5a goes out, then 6, 7, 8, 9 gets activated. You understand? So this is, there is no antibody is involved here. There is no antibody is involved here. So it is a alternate pathway. It is a alternate pathway. In the classical pathway, antibody is involved. In the classical pathway, antibody is involved. So now let us summarize. See, if this is a bacteria and they have an antigen, they have a antigen, and if the antibody comes and attach, okay, then what pathway this is? Classical pathway. So here C1 is involved, then C4 is involved, C2, C3, C5, then 6, 7, 8, 9. Okay, now what are the antibodies can do this? G and M. G and M. All understand this? This is classical pathway. Now let us discuss about alternate pathway. Here the antigen is there. Okay, now in the surface is exposed. Okay, for example hepatitis B surface antigen, it is coming in the hepatocytes is releasing. In chronic hepatitis, hepatocytes keep on releasing the hepatocyte B surface antigen. It is only antigen, because they don't have DNA. So hepatitis B surface antigen is keep on released. So automatically now consider it is a hepatitis B surface antigen. Now it is coming. Automatically C3b gets C3 activated, C3b, C3a is formed. Then automatically factor B. Then this 3 will convert again C3, because this is C3 convertase. This is C3 convertase, again C3b. Then this all will become C5 convertase. Then C5b. Then 6, 7, 8, 9. Understand? Okay. Now this is a classical pathway. Here, which is the one triggers this reaction? Any antigen. Any antigen, exposed antigen surface. And I'm going to add, if there is IgA, immunoglobulin A aggregates, I will tell you what it means. Where immunoglobulin A is found? Immunoglobulin A is found in the mucosal surfaces, because mucosa needs protection, so it is coated with antibiotic. It is like antibiotic coat. It is coated with IgA. It is coated with IgA. This IgA, if for example person got some viral infection, okay, in the or for example viral infection in the mucosa or pharyngitis. Now the more IgA is produced, okay. Now more IgA, it has to be removed. Antibodies has to be removed. If it is not removed, it forms a aggregates. Okay, now we got IgA aggregates. This is full of IgA aggregates. Now IgA is aggregated. Understand? Now what is this? This is IgA aggregates. This IgA aggregates can activate the complement. Understand? So for example, if the IgA aggregates settle below the skin, what will happen? It will activate the complement. It will activate the complement, and what will happen? It will bring. It will produce the inflammation. It will produce the inflammation because the C3b, if the C3b is formed, then the neutrophil, macrophage, all will come and produce the inflammatory reaction, right? So one more thing, there is a C3a, C5a, all formed, right?
Yes.
They are called anaphylotoxins. Anaphylotoxins. They invite the neutrophils as well as, mast cells.
Yes.
Mast cells, they have receptor for them. They have receptor for C3a, C5a. Once this goes and binds with the mast cell degranulate. Mast cell degranulate. Understand? So that will produce massive reaction. So local immune reaction. If it happens in the skin, okay, what is the condition name? It is called dermatitis herpetiformis. It is called dermatitis. Dermatitis means inflammation of the dermis, skin. So herpetiformis, first they thought it is due to herpes virus. They thought it is due to sexually transmitted herpes virus. Then they found it is not due to herpes virus. It is due to IgA aggregates. Due to IgA aggregates, they form full of vesicles. Dermatitis herpetiformis. Understand? So this is one condition. Okay, another condition is okay. This is related to the renal disease. Now there is a IgA aggregates. Okay, or for person got pharyngitis or any respiratory illness, they got viral illness, okay, then IgA is produced more, then IgA is aggregates going to the blood vessels, aggregates is depositing in blood vessels, glomeruli, lung, skin, bone, understand, joints, synovial membrane, all it's going and deposits. It produces multi-systemic disease. Understand? So it is going to deposit in the glomeruli. It is going to cause glomerulonephritis. It is going to deposit. I will tell you in the diseases where it deposits in the glomeruli. Now we take it. It deposits in the glomeruli. It produces glomerulonephritis. It deposits in the pleura. It produces pleuritis. If it deposits in the blood vessel, it produces vasculitis. It will deposit in the joint. It produces synovitis. Understand?
It's like an autoimmune disease.
Yeah, it is like a autoimmune disease, but it is not autoimmune disease. Why?
Yeah.
It is like autoimmune disease. It is not autoimmune disease because once the person's IgA aggregates are removed, the disease goes on. And the person gets again infection, then more IgA is formed, again he gets back the disease. It is like an on and off disease. Understand? So this is called Hinoch Sholin Purpura. Something like Chinese name. Hinoch Sholin Purpura. Very, very important disease. Very, very important disease. Okay. So now you got the point.
Yes.
So this is the problem in the
IgA aggregation.
what pathway?
Alternative.
Alternative pathway. Okay. So you all understand IgA aggregates or antigen surface can trigger alternate pathway. Can trigger.
IgA, how can I remove it from the body?
Yeah, so you can remove it if you have a good macrophage system. You have a good macrophage system. Wow, the problem is not in the removal of IgA. The problem is that fellow is forming more IgA. So how the antibodies are removed? That is your question actually. Okay, so antibodies are removed by macrophage system, phagocytic system. Okay, now antibodies are formed, right? These have FC portion, right? Okay, now we have a macrophage. Macrophage has Fc receptor. Okay, they remove it. Understand? Or okay, now normally we have limited amount of macrophage, normal limited amount of antibodies they will remove. If the person produce excessive antibody, what macrophage can do? So automatically they form aggregates, they go and settle. When they settle, they trigger the alternate pathway. They trigger the alternate pathway. You all understand this?
Yes.
Okay.
Is there any drug that support the macrophage or the production of macrophage?
No, that and all very dangerous drugs. Okay, so there are some growth factors that and all in the experiments we do. Very dangerous because it leads to the cancer formation. Okay, so inshallah that we'll discuss when time comes. Okay, so now you understand. Okay, now this is due to the problem in the increased production of IgA due to some infections, on and off infections. Okay, now this is one problem. Another problem is, for example, if the antigen antibody complex are formed, it has to be removed, because if it is settled somewhere, it will trigger the complement. It will trigger the complement. What complement pathway is triggered? Classical pathway. Classical pathway is triggered. Understand?
Yes.
Okay, now which pathway has C4? Classical pathway, mashallah. So when I check C4 level, or when the tissue of the renal biopsy is showing C4d positive, okay, C4, I told only C4a, C4b, no?
Yes.
Okay, then it is divided into C4c, C4d. That are all small subproducts that will go on excreted in the urine. Understand? So what happens if it is massively produced? That will go and deposit in the kidney. That will go and deposit in the kidney. Understand? So if there is C4d positive in the kidney biopsy, which means there is activated classical pathway. Activated classical pathway. You understand? Okay. If C4d is deposited in the kidney, it is positive. C4d positive, it is activated classical pathway. Why it is activated? Because of increased antigen antibody complex. Because of increased antigen antibody complex, we have to see why this antigen antibody complex are forming. If you are not able to find answer for it, this will keep on occurring. Understand? So why this antigen antibody complex are forming? That is the major important thing. Understand? So this concept is very important when you do renal transplantation. When you do for example, I am putting acyl kidney in me. Okay, so my immune system thinks acyl kidney is a foreign substance. So automatically antibodies are produced against the acyl kidney's endothelium. Understand? So when my antibody go and sit on the acyl kidneys endothelium. Understand? So immediately antigen antibody complex are formed. Immediately classical pathway is activated. So C4d is more formed in the kidney. So C4d will be fully deposited. So if C4d is positive in the transplanted kidney biopsy, you understand? Transplanted. So his kidney is transplanted.
Yes.
So my kidney is I am getting full of hematuria after transplantation, which means there is severe inflammation is happening. So they take a biopsy and they see the biopsy, and I put a special stain C4d, and if it is positive, it is antibody mediated rejection. Antibody mediated rejection. You understand the concept here? Nothing to memorize here. Okay, why it is antibody mediated rejection? By seeing C4d, I am telling, because a classical pathway is activated. Why classical pathway? Antigen antibody complex. Why antigen antibody complex are found? Because his kidney is mismatched. Okay, so that's all. This is very simple. Understand? So you know this, nothing need to be memorized. So this is about understanding of classical pathway and the alternate pathway. Okay, so now there is another pathway. Inshallah, when time comes, I will tell. Okay, so it is lectin pathway. Understand? So now it is not needed for respiratory diseases. Okay,
It's related to respiratory disease.
it's related to other systems, but very rarely we encounter. It is Manos binding pathway. So inshallah we'll discuss that afterwards. Okay, now now I'm going to discuss one more thing regarding the alternate pathway. In the alternate pathway, you guys have to tell me what happens. Now there is a antigen surface. Okay, what will happen? Now the antigen surface is exposed. Tell me what happens. No, I'm talking about alternate pathway.
C3.
C3 is activated. Okay. Then factor B. Okay. And factor B. Okay. Then again C3B. Okay. It keeps on going. Like now we have two things. Okay. One is, okay, I use darker one. One which stabilize the factor B. Understand? And the C3B, because that should be stable. If it is separated, then this cannot happen. Understand? I'll draw again. Now this is the antigen. Now we have C3B activated. Okay, and factor B. Okay, any doubt? Clear. So this 2 is called C3 convertase. So now to make themselves as a C3 convertase, for example, I and acyl should be stand together. Okay, if I both separated, so our strength is lost, right? So likewise, for example, uh, uh, that so somebody has to facilitate us, right? Somebody has to make us more stable. Okay, so that there is a factor which stabilizes it. Understand? There are some factors which destabilize it. Okay, because thousands of antigen is coming to our body and going out. If all the antigen our immune system is reacting, then we will die. Understand? Our immune system will kill us. Understand? So that's why Allah subhanahu wa ta'ala made a wonderful concept here. One is someone, it is stabilized. If the antigenemia, that is antigen is produced more, then we need more stabilizing factor which stabilize the C3B and factor BB. Understand? If the antigenemia is less, then we need more destabilizing factors. Okay, so we have, yeah, factor H. Okay, and actually just to follow my terminology, factor H and I. Okay, so it's not wrong in following this. Okay, don't worry, then don't come and show me the books. So factor H and factor I. Okay, so high H means there is a protein which holds the factor B. Understand? The I is the protein which they hold and they cut. Understand? So there is a protein which holds this complex, then factor I cuts it. Understand? So it destabilizes it. Destabilizes it. Okay, so then there is a factor which stabilizes it. Okay, so this factor is called C3 nephritic factor. C3 nephritic factor. This is old one. So this is C3 nephritic factor. This is very important. Why I'm bringing the name here? Because if this is more, that will produce nephritis. That will produce glomerular nephritis. Understand? You understand? Because if this is more, what happens? C3B will be activated. Then the continuation of the pathway happens. Once again, I tell you, brothers. See, this is the antigen. Now, normally C3B activates and factor B activates. Sorry, factor B activates. So normally, if the antigenemia is less, they go for destabilized, and that will go and remove. Okay, and what happened here is now it is too much of antigen, so automatically we have C3 nephritic factor. Okay, that will stabilize it. So then they proceed C3B and C5B and 6, 7, 8, 9. Understand? They go and destroy. If this goes and deposit in the endothelium, this deposit in the endothelium, this hole will happen in the endothelium. They will destroy it. Okay, they will destroy any surface where they go. Okay, so you all understand this. This is very dangerous.
Okay, doctor. About C5, C6, C7, it's also create C5A, C6A, C7A.
Yeah, that and all it's not having significance. That component and all does not have significance. Understand? So the most component has significance is C3A, C5A. Okay, because they stimulate the mast cell. They stimulate the mast cell. You all understand this?
Yes.
Okay, so this is about the importance of C3 nephritic factor. In some individuals, the C3 nephritic factor is more. Okay, and they will get glomerular nephritis. Okay, and this glomerular nephritis will be very destructive. Understand? They destroy the endothelium, and the endothelium try to divide and bring, and there will be increased cellularity, destruction, and severe hematuria. That's why they produce nephritic syndrome. Understand? That's why we call it as a nephritic factor. That's why we call it as a nephritic factor. Understand? In some individual, they have decreased factor H and I. So automatically there is no deep stabilization. So then that will produce nephritis. That will produce nephritis. You all understand this? This is about the importance of knowing the classical and the alternate pathway. Understand?
Cancers? C3 nephritis, is it cancers?
Is it?
Cancers, if it's
No, no. That you mean the proliferation which happens.
yes.
No, no. It will not become cancerous because there is no time to live. If you leave that patient within week time, that kidney is collapsed. Okay, so completely kidney becomes damaged. So they will become renal transplant dependent. Okay, so this is all about nephritic. This is all about complement system. About we discussed only about two pathway, that is classical and the alternate pathway. When time comes, we'll discuss about another pathway. Okay, this is about the complement. We'll discuss about very mildly. I will discuss about hypersensitivity. Okay, because I feel you people are tired. Okay, so because somebody please tell if you are tired, because I keep on going because teaching is fun for me. Huh? So okay, so now okay, so now see, hypersensitivity means something. I'm telling you, it is very simple. If you see the Robbins definition, it is very complicated. So hypersensitivity is something, any immune reaction, if they destroy our tissue, it is hypersensitivity. Okay, so any immune reaction, if they destroy our tissue, that is hypersensitivity. If immune reaction, if they are not destroying our tissue, it is good. It is normal. It is, we need sensitivity. Okay, but like how, like emotional we get, we need emotions, but we don't need hyper emotions, because that will lead to destruction of us and the surroundings. Okay, so that you can see in common people. Okay, so that's where Rasul told angry is not good. Okay, lag adab, right? So now coming to the point of immunological hypersensitivity, the hypersensitivity means any immune reaction if they destroy our immune tissue. That is the thing. Okay, now there are four types of hypersensitivity: 1, 2, 3, 4. Okay, 1, 2, 3. These are antibody oriented. Antibody oriented. This cell mediated. Cell mediated. In other words, they are B lymphocytes involved. They are T lymphocytes involved. T lymphocytes involved. Okay. So in any immune reaction, we need antigen, we need antibody. Simple, right? We need antigen, antibody. Nothing to be memorized. We need antigen, we need antibody for a immune reaction. Okay. So now you should know, in type 1 the antigen comes from where? Type 1 the antigen is always exogenous. Always something coming outside the body. Okay, like pollen, like dust, like any irritating substance which entering the nose. Okay, and that's why they get any new environment they go, they get this type 1 hypersensitive reaction. The antigen is always exogenous. Genius. Inshallah, in the immunology we'll go detail. So just I'm telling them very catchy point, so you can easily remember. So antibody here always IgE. Okay, IgE antibodies. Understand? Okay. Now, what is the effect they give here? There is a mast cell that has IgE receptors. So IgE goes and sits on that. Okay. Then two IgE joins together here. Then degranulation happens. Understand? So the effector cell is mast cell. The mechanism is mast cell stimulation. Mast cell granules will produce the effect. Asthma. Okay. So this will produce the effect. It can happen locally also. Eczema. Okay. So these are the things it happens. Understand? So here the antigen is exogenous. Okay. And here antibody is IgE. So the effector cell is mast cell oriented reaction. Okay. Likewise here in type 2 hypersensitivity reaction, here the antigen is intrinsic. Here the antigen is intrinsic. I am giving example. Now you all know glomerular basement membrane. Okay. So if there is any antigen here, okay, that is for example non-collagenous domain. Non-collagenous domain of the type 4 collagen. Okay. So that is a intrinsic antigen which is present in the body. Okay. Intrinsic, which means something inside the tissue, inside the, not only inside the body, it is inside the tissue. It is intrinsic component. It is a intrinsic component of the tissue. If the antibody will be of IgG or IgM, IgG or IgM. Understand? So this will come and bind. Now there is a antigen. Now antibody comes and bind. What happens? Now antigen antibody complex is formed. What will happen? Yeah, classical pathway will be activated. Okay. So what happen? So automatically C5b is formed. That will stimulate the, and C5a, C3a are going. They all invade the neutrophil. Then all neutrophil comes, the attack happens. Then they produce massive inflammation. That will produce massive inflammation. Understand? So here the effect is due to complement activation and activation of the neutrophilic system. Okay, inflammation, activation of the inflammatory system, acute inflammatory system. Okay, you all understand this. And here the concept, one other concept we have to understand here is it is intrinsic antigen, right? So it is specific to certain tissues. It is specific to certain tissues. Understand? So this anti-glomerular basement membrane, glomerular basement membrane is in the kidney. So the disease will be seen in the kidney. Understand? Okay. Now there is antigen may be coming from outside or formed inside, but it is in the circulation. It is in the circulation. Understand? So the antigen is in the circulation. This is the circulation. The antigen is in the circulation. In the circulation, the antibodies are formed. Okay, the antibody complex are formed. Understand? So again, this can go and deposit in any organ. It can go and deposit in any organ. What will happen? It will lead to multi-system disease. It can lead to multi-system disease. Okay, autoimmune diseases. Most of the autoimmune diseases have this kind of problems. Okay, it will produce multi-system disease. If this antigen antibody complex going and depositing in the kidney is spoiled. The kidney is spoiled because classical pathway is activated. Classical complement pathway is activated. You all understand this? Yes. Okay. Now, okay. the cell mediated hypersensitivity reaction, it is due to the T cell mediated. Example is TB granuloma formation, that is the type 4 hypersensitivity reaction. Okay, I'm not going to talk in detail about that. Now you understand the concept of type 1, type 2, type 3. So type 2, type 3 involves the glomerular disease. Type 2, type 3 involves the glomerular disease. Type 2 hypersensitivity reaction will involve the glomerular disease. Okay, so I'll conclude here. Okay, so tomorrow we will be talking about the glomerular disease. Okay, so I want you all guys to just refresh these things and come, because I'll be more interacting with the glomerular diseases. So I expect you people tell me the pathogenesis. I'll give you the starting point. All other things we will discuss. Okay, so it is so simple. I'll make it. It will be very easy.
Okay, doctor, what's the difference between the type 3 and the type 1?
See, type
Type 3 in the circulation. Okay. Type 1, it's not in the circulation?
From outside
type
the body.
1, the antigen is exogenous,
Yes.
and it is coming, and it is not even coming to the circulation, it is even directly goes to the tissue. Directly goes to the tissue. The antigen is taken by the dendritic cells into the tissue. Understand? If you see the asthma, that the antigen is taken by the dendritic cells and goes into the submucosa. Goes into the submucosa.
Also type 2. Also
Yeah.
directly to
So
the
type 2,
is
actually the antigen is intrinsic.
Intrinsic, yes.
Antigen is in the body, intrinsic. Okay, and it is not circulating, it is intrinsic. Understand? So there are other 2-3 concepts there. When the glomerular disease comes, I will explain that. Okay, there are planted antigens. Okay, that concept inshallah we will discuss more. The glomerular diseases. Okay, so I stop here. Okay, subhanakallah.